Hello, I'm Dr. Kimberly Eickmeier with the Department of Podiatry at Christie Clinic here, and today I'm here to talk to you about heel pain. We used to call it heel spur syndrome, but we know nowadays that it's not the spur that causes the pain. What it's called is plantar fasciitis. Let me explain that to you. This is a model of a normal foot, which I don't see here. This is the big toe side, and what we find here is we've got a good arch. The bottom of the foot is called the plantar surface, thus plantar warts. There's a band of tissue, it's kind of like the bow on a violin, that runs from the heel to the toes, to the ball of the foot. When we have a flat foot like this, it gets stretched, and it literally rips off of the heel bone, bleeds, calcifies, and forms a spur. So we have people that come in often with heel spurs that don't have pain. So let's talk about how we get rid of this. First of all, we want you to start stretching. If you have a tight Achilles tendon, your arch can fall even more. I'd like you to start icing at least 4 times a day for 20 minutes. Get some good shoes and wear some arch supports. Now, what do I mean by a good shoe? There's the 1, 2, 3 test. Number 1, the shoe should not be flimsy, should not stretch from side to side easily. Number 2 is for toes. The shoe should bend where the toes bend. And number 3, this is called the heel counter. There should be an area for cushioning for your Achilles tendon, but you should not be able to take your thumb and push it down to the inner sole. I'd recommend that you go to a store that doesn't have high school kids that measure you. Go to a good running store. There are some other causes of plantar fasciitis besides running, but obviously we see a lot of runners with plantar fasciitis because they're very active and they're pounding on their feet quite a bit. If you still have pain, heel pain after 3 weeks of icing and stretching and wearing arch supports, I'd like to have you come into the office or see a foot doctor, and what they can do is they can tape you up like an athlete, show you how to do that, maybe give you some ultrasound, order some physical therapy, and you may need custom arch supports or orthotic devices. Other causes of plantar fasciitis may be obesity, like I said before, flat foot. Sometimes a high arch foot can cause the pain as well. Sometimes what we find is that it's not actually plantar fasciitis. It can be damage to nerves that run down to the heel. And with the minimal shoe or the barefoot running, I have seen that. I've actually seen nerve damage. So if you are a pronator rolling the foot in, causing a flat foot, you really should not be barefoot running or running the minimal shoes.